As you recall, blood vessels are distributed throughout body tissue. When soft tissue is injured, bleeding will occur. Bleeding reduces the oxygen-carrying capacity of blood in a patient's body. If bleeding is severe, it can quickly become life-threatening. Limiting blood loss is a high priority when you are caring for an injured patient. Blood flows away from the heart in arteries. Arterial bleeding is the most difficult to control because of the pressure created by the heart's contractions. Bright red, oxygen-rich blood will spurt from a wound that involves an artery. If the blood is dark red and flowing, it is most likely coming from an injured vein. Veins return blood to the heart. Bleeding from a vein can be heavy, but it is usually easier to control than arterial bleeding. Keep in mind, bleeding may appear to be more serious than it really is. Clot-forming fibers in the blood will collect at a wound site and attempt to create a patch or clot to stop the bleeding. Your attempts to control the bleeding will assist this natural process.
Say, here are the things we need. Where should I put it?
Slate over there. I want to get this wire connected before we deal with anything else.
Sounds good.
Oh, man. I cut myself.
Really? How bad is this?
I think it's pretty deep.
Okay, look, I've got training in first aid. I can help. Let's take a look at that. Oh, yeah. Keep pressure on there. Right here. This is a clean towel. You need to put it on a spot that's bleeding and press firmly with your fingers. Okay. Now I want you to sit down and keep pressure on the cut. I'm going to go and get a first aid kit. I'm also going to call some help, okay?
Okay.
I'll be right back. Dispatch, this is E11.
This is dispatch. Go ahead, E11.
Kelly Bennett had an accident and cut his arm. Can you call us an ambulance? We're at the Peterson Building job site.
All right. I'll call it in now.
Alrighty, we'll be at the side entrance. I'm going to go back and try to control the bleeding.
Got it.
How are you doing?
Still bleeding.
Okay. Okay, move your fingers. I'm going to put on a new dressing. I'm going to hold it down now. All right, just take it easy. I call for some help. They should be on the way.
Okay.
A bleeding patient exposes you to potentially infectious body fluids. Use barriers, such as disposable gloves and glasses, to protect yourself and the patient. To begin, quickly inspect the wound to locate the exact point of the bleeding. Using a clean, absorbent pad, apply direct pressure with your fingers. If a pad is not available, apply pressure immediately with just your gloved hand. If the wound continues to bleed and soaks through the pad, apply more pads. Leave the initial pad in place to prevent disruption to the forming clot. Consider using the palm of your hand to apply more pressure. Targeted direct pressure is the most effective treatment for external bleeding. It's unlikely that any other treatment will be necessary. If you can control bleeding with direct pressure, apply a pressure bandage to provide continuous pressure to the wound. Wrap a roller or elastic bandage around the injury, incorporating enough pressure with the bandage to maintain bleeding control. Avoid wrapping the bandage so tightly that it causes numbness and tingling. Have a patient provide self-care or use improvised barriers when emergency supplies are not available. Never let the sight of blood or open wounds distract you from following the priorities of care. Make sure a patient has an open airway and adequate breathing before you attend to external bleeding. Multiple treatments can be done at the same time. Work together with others to provide complete care for the patient.
Okay, guys, that's it. Let's get going.
Hey, I'm gonna hitch a ride with you guys instead of walking.
Works for me.
Not a problem. Andy, are you all right?
Yeah, I think so. Just knocked the wind out of me.
All right, just take it easy. Catch your breath.
It's gonna leave a mark.
He's okay.
Andy, do you still want to ride back here?
No, I think I changed my mind. I think I'd rather walk.
All right. Well, how about we see you on the other side?
Yeah, I'll meet you guys down there.
Okay. Take it easy.
All right.
In a medical emergency, shock occurs when the body cannot supply enough oxygen to body tissues. If not recognized early, shock can worsen over time and become life-threatening. There are many mechanisms related to illness and injury that can cause shock to develop. Bleeding reduces the amount of blood available to carry oxygen. Difficulty in breathing can limit the amount of oxygen brought into the body. Damage to the heart from injury or disease can diminish the ability to circulate oxygen. Injury to the spine can cause blood vessels to widen, creating a drop in the pressure needed to keep blood and oxygen flowing. Bleeding from an internal injury is often associated with shock. Generally caused by a blunt blow to the chest or abdomen, it is hard to detect early and nearly impossible to control. It is best to assume any patient who is ill or injured has the potential to develop life-threatening shock. Early signs of shock are often difficult to detect. A patient may simply appear uneasy, restless, or worried. Other signs and symptoms will emerge gradually. A patient's skin may become pale, cool, and clammy. The patient may become less responsive. A patient in shock must get to a hospital as quickly as possible. Shock can reach a point where it becomes irreversible. Early recognition, early treatment, and activation of EMS are essential for survival. Basic priority care, such as maintaining a clear and open airway, ensuring adequate breathing, and controlling any external bleeding, will help slow the progression of shock. When shock is suspected, position a patient on his back and elevate his legs about 8 to 10 inches or 20 to 25 centimeters. This will supply the heart with additional blood from the legs and help to improve circulation. However, if a patient has difficulty breathing, she may not be able to breathe easily lying down. Instead, help her find and maintain a comfortable, upright position. If you suspect a patient has an injury to his spine, it is best to leave him in the position you found him in. Maintaining a patient's normal body temperature is also important. Insulate on top of and underneath the patient to prevent heat loss. Keep the patient comfortable and as calm as possible. Avoid giving him anything to eat or drink. Giving emergency oxygen when treating shock is beneficial. If emergency oxygen is available and you are trained to use it, offer it to the patient.
Maggie and I leave Friday morning on a direct flight. We should be in Atlantic City by early afternoon.
Gee, that sounds like a great trip.
Yeah, where's Howard going?
I don't.
I've been there a few times. It's a great getaway. Where are you guys staying?
Oh, some casino hotel my wife knows.
Mark, what's wrong? Are you okay?
Are you choking? Steve, go call EMS.
Right. Bridget, would you call 911? Mark's choking in the lunchroom.
Yes, I will.
Thank you.
Okay, relax. Try to take some deep breaths. Relax.
Bridget called 911. Do you want me to go tell her to call him back?
No, Mark should still be checked on just in case. Okay, why don't you go wait outside, lead them in when they get here, and I'll stay with Mark.
No problem.
Just relax. Take some deep breaths. There you go, relax.
Choking occurs when food or other solid objects become lodged in the lower throat and block the airway. Unlike objects in the mouth that can be removed easily, objects blocking the lower airway cannot be seen or reached with a finger. Because the airway is blocked, choking patients cannot pull outside air into the lungs and create a cough strong enough to expel the obstruction. The best chance for removing an obstruction is to use abdominal or chest thrusts. These thrusts compress the chest or abdomen and build up pressure behind the obstruction. This pressure will pop the object out and clear the airway. The most common thing people choke on is food. Someone who is choking usually holds his hands to his throat as he attempts to try and clear the obstruction naturally. This can be a helpful sign in recognizing a choking person. If you think someone is choking, get his attention and simply ask, "Are you choking?" Choking results from a severe airway obstruction. Signs of severe airway obstruction include very little or no air exchange, lack of sound, and the inability to speak or cough forcefully. If the patient nods to indicate he is choking, act quickly to relieve the obstruction. Stand behind the patient. Locate the belly button with one finger. Make a fist with the other hand and place the thumb side of your fist in the middle of the patient's abdomen, just above the navel and well below the breastbone. Grasp your fist with your other hand. Quickly thrust inward and upward. Each thrust should be separate, distinct, and given with the intent of forcing the object out. Repeat the thrusts until the patient can breathe normally or he becomes unresponsive. If a choking patient becomes unresponsive, get her to the ground as gently as possible, protecting her head in the process. Activate EMS and begin CPR. Every time an airway is established for ventilations, inspect her mouth, remove any visible material, and resume CPR. When a choking patient is clearly pregnant or obese enough where you cannot get your arms around their abdomen, use chest thrusts instead of abdominal thrusts. Position yourself directly behind the patient. Place the thumb side of your fist on the lower half of his breastbone. Grasp your fist with your other hand and thrust straight backward. Try not to put pressure on his ribs. Continue thrusts until he can breathe normally. If he becomes unresponsive, get him to the ground and begin CPR. Abdominal and chest thrusts can cause internal injury. Anyone who has been treated for choking with these maneuvers should be evaluated by EMS or a physician to be sure no injury resulted.